Good morning. If you have decided to study to become a professional hypnotherapist, continue with us in this nice project of study and learning. Hypnosis is a powerful technique with which you are able to help and improve the quality of life of a great number of your future patients. Remember to study the description of this video, where you can find a link to classes on clinical hypnosis with several free ebooks, also free of charge. Recommended energy and nutrient intakes. To evaluate the nutritional status from a dietary point of view, that is, to know if the food we eat contains and provides enough nutrients, the so-called recommended intakes are used as reference standards. Recommended intakes are defined as the amount of energy and nutrients that the diet should contain on a to maintain the health of virtually all healthy people in a group, 97.5% of the population. The figure includes a sufficient amount of each nutrient to cover the requirements after reducing all possible losses that occur from the time the nutrient is in the food until it reaches the body, and also losses due to incomplete utilization result of individual variability in digestion processes, absorption, and metabolism. For example, the amount of iron required daily for this nutrient to perform satisfactorily all its multiple functions is approximately 1 milligram requirement. However, in practice, it is necessary to ingest 10 times more, mainly due to the fact that the digestibility of iron, that is to say, the percentage absorbed in relation to the percentage ingested, is very low, from 10 to 15%. The concept of recommended intake also considers the quality of the nutrients in the foods consumed, or the modification that nutrients undergo when foods are subjected to different culinary industrial preservation processes. For example, the recommended intakes of vitamin C, the most sensitive vitamin, the one that is lost in greatest quantity in culinary processes, will be higher in those population groups that obtain it mostly from cooked foods. They are also different for each individual, depending on their age, sex, physical activity, which mainly modifies, and in the case of women, according to the possible physiological state of pregnancy or breastfeeding. For example, the needs for calcium or protein are greatly increased during adolescence, as this is a time of intense growth, or during pregnancy. The different body composition between men and women have a higher proportion of fat, metabolically less active, leads to differences in energy needs. Also in women, throughout fertile life, recommended intakes of iron are higher due to losses during menstruation. Similarly, people who smoke and drink regularly may have for some antioxidant vitamins such as vitamin C, E, and carotenes. The recommended intakes are expressed per person per day. This, however, does not mean that the diet has to be adjusted to the recommendations on a day-to-day basis. The average diet is usually judged to be approximately from 7 to 15 days, because a well-nourished person with an adequate nutritional status has sufficient body reserves to cover the possible daily variations in nutrient intake. In other words, it is not essential that we take the necessary 60 milligrams of vitamin C every day. If over the course of a week the average amount consumed matches the recommended amount, this greatly simplifies the programming of diets for healthy people, as it is difficult to adjust the daily intake of each nutrient. The recommended intakes are included in the tables that the components bodies in each country have prepared. for the population at which they are aimed. In Spain, the Department of Nutrition of the Faculty of Pharmacy of the Complutense University of Madrid is in charge of establishing them for Spanish population. Energy requirements are calculated for moderate activity. For light activity, reduce the energy requirements by 10%, and for high activity, increase it by 20%. Differences between men and women are compensated for by their inclusion in the classification of activity types. Individual energy needs are from the basal metabolic rate, BMR, using the equation proposed by Hu, 1985. Table 1. The expenditure corresponding to physical activity is calculated from the BMR multiplied by the coefficient in Table 2, according to the type of activity performed. No recommended fat intakes are given, but it is recommended that its contribution to the total energy should not exceed 30–35%. Linoleic acid should provide between 2 to 6% of energy. Recommended protein intakes are calculated for the average quality of protein in the Spanish diet. MPU equals 70, except for infants, where they refer to milk protein. Calculated on the energy intake recommended in these tables according to the following coefficients: thiamine 0.4 mg, riboflavin 0.6 mg, and niacin equivalents 6.6 mg per 1000 kilocalories. 1 niacin equivalent equals 1 niacin or 60 mg of dietary tryptophan. 1 retinol equivalent equals 1 mg of retinol or 6 mg of B-carotene. Expressed as cholecalciferol. For older people with low sun exposure, 10 mg per day is recommended. Expressed as alpha tocopherol. Activity class: light sleeping, resting, sitting or standing, walking on level ground, light housework, playing cards, sewing, cooking, studying, driving, typing, office workers, etc. Moderate walking at 5 km per hour, heavy housework, window cleaning, etc. Carpenters, construction workers, except hard work, chemical industry, electrical, mechanized agriculture work, golf, childcare, etc. High, non-mechanized agriculture work, mining, forestry, digging, cutting firewood, moving by hand, climbing, mountaineering, playing football, tennis, jogging, dancing, skiing, etc. Comparative equations for calculating resting metabolic rate: Hu 5 from weight P 2 kilograms. Average energy requirements of adults according to light, moderate or high physical activity expressed as multiples of RMR. If you're interested in learning more about clinical hypnosis, watch our next video, The Influence of Diet in the Prevention and Improvement of Certain Disease. Remember to study the description where you can find a link to free training classes on clinical hypnosis, with several free ebooks too. If you have questions, add them in the comments area. About this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, don't miss our next videos. Thank you very much.